He wanted to live, he wanted to be here, but he had no help.
Shane Turner's mother says he was rushed to hospital after a drug overdose in November 2021. He received medical care but was released within hours.
He wanted to go to detox, he wanted to see an addiction counselor. He asked 7 times.
Shane Turner's family says he didn't want to be released from hospital. The hospital records show he asked healthcare workers 7 times to be sent to detox. Instead, he was released with pamphlets and a cab voucher. The 31-year-old died that same day of a fentanyl overdose.
We definitely feel defeated as a family.
His family and the opposition NDP called for an inquest into how he died. Instead, Chief Coroner Clive Wayhill did his own investigation and came up with 2 recommendations for the Saskatchewan Health Authority.
When people need an addictions bed, if they don't get one right away, we see them going back out and then returning into their drug habit again. So I thought it was very important to get a recommendation as quickly as I could to the SHA.
One recommendation is to give naloxone kits to people treated for drug toxicity or addiction before they're released from care. The other is a formal protocol to give ER patients immediate access to detox beds. Harm reduction advocates agree things need to change.
And at some point, our governments need to stand up and say that we're not going to stand for these deaths anymore.
While Turner's loved ones didn't get the inquest they had hoped for, they say it's still something.
I want him to be remembered as a change in the system.
That's what we really want.
I don't want him to be just another number on a report.
The Saskatchewan Health Authority says it will take several weeks to review the coroner's recommendations. Jesse Anton, CBC News, Regina.